Good evening, everyone. I hope everyone is doing well out there. Today is February 3rd. Yes, I am Dr. Vivian Asamoah. I'm a gastroenterologist. Good evening, everyone, again. Thanks for joining me on this live Facebook. And if you're listening to the replay, do enjoy it. I am Dr. Vivian Asamoah, and I am a gastroenterologist in Katy. I practice general gastroenterology, and I'm also a functional medicine provider. And for this month, for the month of February, I have set myself a little month challenge to talk about a GI topic every evening. And yesterday we touched on, what did we talk about? Dysphagia, trouble swallowing. And tonight we are going to be talking about the melodies of the gut. So belching, burping, hiccups, we can call it eructation, whatever. Those are basically the names. And if y'all can hear me, just shout out, leave a like or a love or a comment. And I'd love to get some feedback from you guys. So I wanted to share a few things. Today is what is it? We celebrated today, actually. Happy National Women's Physician Day. So a big shout out to all female physicians out there. Today is our day to celebrate. We got another one, we got a Mother's Day, we got Women's Day, now we got Happy National Physicians Day, Women's Physicians Day, so that's awesome. So no one said anything at work. It was a regular day, and so what I did is I sent out a little Google post of a Happy National Women's Day out to all my staff, and they were like, oh, we didn't know about this. I said, aha. So next time they'll remember February 3rd. It was really a day to share with all my colleagues and female physician friends, because this work-life balance thing is not easy. I just put my kids to bed, and they were with me as I was getting ready, and they made me feel so old this evening because I put perfume on, and my son was like, Mom, come on now. They can't smell you from where they are. Nobody can smell you. So, so I was like, oh yeah, but we just do this as routine. But anyway, let's get right into it. So belching, eructation, burping. After doing the research over the last couple of days, these are not symptoms you want to go to your doctor with, because most of the time they're not going to know. Especially if it's happening over and over again and symptoms are severe, it just appears that for the most part, we can't find what the issue is. But let's break it down. So when it comes to sounds that come out of the gut, there are sounds that come from supragastric, so above the stomach. So it's coming from the esophagus. And there we think people actually just kind of suck air in, contract the abdominal muscles, and belch air out. So that is intentional. It's not believed that is a reflex. It is believed to be like a human behavior, intentional. So we'll see a lot of that in the setting of anxiety, people who are really stressed out. And they'll also notice that when they are very stressed, they're belching more often. So this is apparently called supragastric belching. And then there is, and the fancy term for belching is eructation. In French, we say eructation. So eructation is the fancy term for belching. But then there's gastric belching. So gastric belching is more of a reflex, right? It's almost like we ingest this air, we take this air, and the air fills the stomach, and the stomach just automatically contracts, relaxes that lower esophageal sphincter, and it comes out. So this is reflex driven. You can't intentionally drive gastric reflex belching symptoms because it's purely reflex. And we'll see that gastric reflex belching when you overeat. So yeah, right? When you have that big turkey, that big meal for Thanksgiving, and you're like, ugh. Yeah. That's because you overate. The stomach is really stretched out, and that's where we'll see that happen. We'll also see it in situations where there's reflux disease, heartburn, and reflux disease. So just the acid going up the esophagus just irritates that sphincter, and it causes it to relax more often, and then you belch, right? So those are some of the causes of gastric reflux. We see it sometimes in people who have ulcers, in people who have pancreatitis. So anything that has anything to do with stimulation of that stomach lining, the mucosa or outside, and apparently even heart disease. Some people will just, like having a heart attack, will just belch very often. So that was really interesting. So we talked about belching, éructation, okay, in French. And then I want to talk a little bit about hiccups. Now this one is a tough one. I mean, if you go to your doctor with hiccups, first of all, there are no real good solutions. When I looked at therapy for hiccups, this is what I found. I mean, I thought they were joking, but this was actually published in an article. So they said, as part of therapy for hiccups, scare the patient. So I'm not sure what we're supposed to do. Put a mask on, scare the patient, compress their eyeballs. I mean, if someone came to you and tried to, so it's to put you in a state of shock, compress their eyeballs, bite a lemon, swallow sugar, swallow vinegar, carotid massage. So these are just some old school mechanisms to take care of hiccups. And the issue is hiccups is really, the origin of hiccups comes from almost 3 different levels. So there's the afferent nerve stimulation through the vagus nerve and the phrenic nerve, going through the spinal cord, right? So you've got spinal cord involvement, and then the efferent nerve that actually now stimulates the diaphragm and the intercostal muscles to contract, right? So it's like a 3-stage process. And this hiccups, it's not a reflex. It's not intentional. It is happening. It's an automatic contraction that is happening from that 3-way branch. And so hiccups can be caused by many, many things. So if there is any issue in terms of the actual nerves, the vagus nerve, maybe you had neck surgery and someone cut the vagus nerve or the phrenic nerve, or you've got a large nodule or a goiter that's compressing where the vagus nerve actually drives down, that can cause a sort of like a break in that route and cause contraction and cause hiccups. Anything that has to do with if someone has a stroke, so that affecting the brain directly. So a stroke, other vascular lesions, a clot in the brain, meningitis, encephalitis, a tumor in the brain can cause hiccups just through that same mechanism. What else did I see? From the brain standpoint, trauma. So a concussion or trauma can also result in hiccups. And then coming down to the efferent, medications that can affect contracture, anything like that can also cause hiccups. We also believe that anything that affects the diaphragm. So we'll sometimes see hiccups in people who have some kind of intra-abdominal process, like a cancer, a pancreatic tumor. Those are all causes of hiccups. So you have persistent hiccups, which is when you have hiccups for about 48 hours. And then you have intractable hiccups, which is when it goes on beyond a month and the person is just hiccuping. And really, there are no good solutions. As I said, for hiccups, they say try and stimulate the person, like sort of scare them, stimulate their senses. And those are all the things we mentioned. And there are some medications, there are like 10 different medications that can be prescribed. None of them are actually officially FDA approved or shown to work in trials. But I did find one thing that works for hiccups. So if you have intractable hiccups and the doctors can't find a reason, like you've searched, you should probably, a full physical exam, full history to understand the context. Look through your medication list, make sure that this isn't something being caused by medication. Then they do some blood work, because sometimes we'll see hiccups in the situation of electrolyte imbalance. So your sodium is off, your potassium is off, or renal failure. So uremia, we'll see hiccups develop. That's when the urea, one of the kidney numbers goes up. We'll see patients who have a lot of hiccups in terms of symptoms. So we go all the way to doing a CT scan, an MRI of the brain, a lumbar puncture to figure it out. And sometimes we can't find out what the cause is, after doing this full workup. So you may end up seeing a gastroenterologist who's searching for reflux. Do you have a hernia? Is it reflux? You may end up seeing a neurologist who's looking for a lesion in the brain. Your primary care doctor should be looking at all your medications, looking at blood work to see if there's any cause at all. So coming back to treatment, because as I said, you don't want to go with this to your docs because they rarely find the true cause. But it appears that medical marijuana is the best solution. We have seen data. There are studies that show that medical marijuana, there's a trial, it was published, works extremely well for people who have hiccups and helps curb the symptoms. So that is that is one solution we have. One last belching sound or upper GI sound that I'd like to talk about. Today I didn't go into the melodies of the lower gut. We're talking about the melodies of the upper gut. Maybe I'll talk about the lower gut another time, but I really just wanted to focus on the upper gut. So one more, another type of, this one doesn't really make a sound, but we often see patients who describe a lot of bloating and distension, and we can't find any other causes. And so there's something called aerophagia, where they're just swallowing air. It's like so usually that'll happen if you're taking big gulps, you're eating really fast, you're in a rush, you're eating on your computer when you should really be taking a break. I do this all the time to pause and let the GI tract sort of like get its own balance, right? The worst thing is eating fast and working because your digestive tract is in a constant state of fight or flight response. You really should be chilled, relaxed, let the food go down, let all your senses, really relax. And so sometimes that really is, if you're not relaxed and you're eating too fast, you'll swallow a lot of air. Carbonated beverages, chewing a lot of gum, yum, 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 you'll be swallowing a lot of air. And this air just gets trapped in the stomach, and people complain of bloating, right? They complain of bloating and they don't understand why. And it's usually just because of this process of swallowing too much air. When I was doing the research, I actually saw an X-ray of someone who didn't have any issue. They just drank soda all the time. They ate really fast. They swallowed a lot of air. And their entire intestine, large and small, was completely dilated with just air. And so the cause was just, distension from aerophagia. The solution there, a little bit like for suprapubic belching, eructation, when people are actually intentionally sucking air and then just, contracting and then belching. We think this is in part psychological. The treatment there is actually psychotherapy, cognitive behavior therapy, coping with things like OCD, generalized anxiety disorder, and depression, right? So actually getting treatment for that and actually learning how to cope. Because those patients actually never, once you distract them, they will stop belching. And when they're asleep, they stop belching. So that's how you know that this is most likely more related to a brain, psychiatric, anxiety-driven issue, okay? What else did I want to share? I think we've talked about everything. I was going to kind of go short today. I did find some interesting things about hiccups. I stopped at medical marijuana because I think that's the thing that impressed me the most. But medicine will go as far as, cutting that nerve, the phrenic nerve that is causing the hiccups. I've heard of stimulators. But again, the question in medicine isn't always, can we do this? Sometimes the question is, should we do this? Because should we really put someone through this simply because we don't really have an answer? We don't understand the body 100%. Because we're doctors, we know, but we don't know everything. And the body is just a phenomenal piece of art that does a lot of different things that we still don't understand. So I want to close with one of my patients who had horrible hiccups. And it was really sad. We had tried every single medication. Unfortunately, I did not try medical marijuana. And he ended up having a small hiatal hernia. And, I didn't think that was the cause of hiccups, but He went ahead and had surgery and got the whole hernia fixed. And unfortunately, the hiccups did not go away after surgery, and he couldn't belch again. Because when you actually have a hernia repair, they tighten that sphincter at the bottom, the lower esophageal sphincter. So it's like artificially tightened. And so when you have air that wants to actually expel out, it can't because it's all tight. Like it doesn't relax to allow anything. So unfortunately, that was kind of sad. That's what happened to him, and the hiccups didn't improve. So again, belching, hiccups, if it's reflux, great. If it's not, find an old grandma's remedy to fix yourself. If not, the options we have out there are not wonderful. So again, my name is Dr. Vivian Asamoah. It was really nice spending this evening with you. I look forward to chatting tomorrow, and a lot of people have asked me to go off topic. There are a lot of questions about dairy, lactose intolerance, the difference between dairy allergy and lactose intolerance, and talking about the different types of the casein in dairy that can cause allergies and what constitute lactose intolerance, and should we even be testing for that. So tomorrow is gonna all be about milk. We're going to talk about milk all evening tomorrow. So I look forward to that. Again, my name is Dr. Vivian Asamoah. Thank you for joining me on this live, Facebook Live, or if you're listening to the replay, please go ahead and put a like, share some love, leave a little comment in there, and you can definitely type in and comment in "gut over it." This is the name of our little February session. And one more time, happy National Women's Physician Day. Have a wonderful evening. Bye-bye.